Here at RCVS Knowledge, we've been working really hard on the back of the success of the Farm Vet Champions learning platform with the support of the VMD to create an interactive online SMART goal setting tool. And this is the launch, and we're very excited to share this with you. We're very aware of the growing concern around antimicrobial resistance, both the human sector and animal sector. And I'm really proud of all the work that my colleagues have done driving this positive, functional and practical tool to help the industry and everyone involved really focus their attention down on targeting improvements in animal health and welfare and really looking at prescribing levels at the local level. We've got some great speakers for you this afternoon, and I've got the pleasure of introducing our first speaker, Kitty Healy. So Kitty's the head of the Antimicrobial Resistance team at the VMD, and her background spans veterinary practice, epidemiology, government policy and regulation, so the ideal person here. Her work focuses on reducing the unnecessary use of antibiotics in animals and delivering the 5-year National AMR Action Plan from the One Health perspective. And Kitty's going to introduce the context on an antimicrobial resistance and outline the national response from the government perspective. So over to you, Kitty.
Thanks very much, Chris, and thank you for having me. It's really great to be here and at the launch of the Smart Goals tools. So I think let's go to the next slide, because I think what I wanted to do to begin with is just say what the Veterinary Medicines Directorate does. You know, why are we interested in AMR? What is it to us, and where do we fit in? Well, for those of you who don't know, we're an executive agency of DEFRA, part of government, and where we lead is on the regulation of all things to do with veterinary medicines, and we're also the policy lead for veterinary medicines and crucially here for antimicrobial resistance, and we coordinate across DEFRA and also a little bit with the FSA on some of the goals within the UK's National Action Plan for antimicrobial resistance. And so that's our role, and that's where we where we have an interest in this, and we've been supporters both financially and also just in general. We're really supportive of the work of Farm Vet Champions since really since Fiona came to us and explained what the concept was. It fits absolutely in with the concepts that we're looking at with the National Action Plan, and as Chris said, with things that we want to achieve. So next slide, please. And so just taking a step back a little bit, you know, antimicrobial resistance, why do we care? I mean, I'm hoping that everyone on the call is here because you care, but taking that bigger picture view, well, I mean, primarily we care because antibiotic resistance affects clinical outcomes. The biggest headlines are grabbed by the very real clinical outcomes and deaths caused by antimicrobial resistance in people, but we know that although perhaps the data isn't as good on the animal side, perhaps that's also an issue in veterinary medicine, hopefully maybe not as bad as it is at the moment in human medicine, but we definitely want to prevent it getting that bad. And what we've got here is just some screenshots of the front pages of a few reports. There are a whole load to pick from, but on the right are the current UK National Action Plan for AMR and also the 20-year vision for AMR, which is that we have the two because the 20-year vision is trying to get a policy document that recognizing that this is a long-term problem and needs sustained response. And I'll come back to those a little bit later in the presentation, but on the left-hand side, you can see, well, on the bottom, you can see the global action plan. So that's a reflection. It's not just, we're not doing this in isolation. The whole world is working on actions against antimicrobial resistance. But the actual scale of the problem, some of you may remember back in 2016 when Lord O'Neill published his review on AMR, and they did some modelling to try and grasp the scale of the problem, and they came up with figures of around 700,000 deaths by in 2016 in people. These are all people figures, projecting to 10 million by 2050. And they did some economic calculations and estimated that that would lead to an economic cost in lost productivity of $100 trillion globally. Those are big figures. They've been disputed a bit in the methodology, but just this January, I think it was, the Graham report was published by the Global Burden of Disease reporting by the Graham Institute in the Lancet, and they looked these tried and tested methodology. They looked at 2019 data. Again, this is all human, and with this, they estimated that in 2019, 1.27 million deaths were directly attributable across the world to antimicrobial resistance, and just under 5 million were associated with antimicrobial resistance. So that's significant. Even the more conservative estimate is significantly more than the O'Neill estimate. So we're definitely dealing with something that is serious. And I haven't actually got them in front of me, but to put this in context, this means that there are more deaths caused by AMR compared with some of the things that we're really familiar with. I can't remember them off the top of my head, and I really should have them to hand, but I think that they included HIV, TB, and some other things that you will have absolutely heard of and recognize as significant issues. So within all of this, so coming back to those UK policy documents and back to a little bit, away from the sort of the apocalyptic kind of human scale of things and to what we're talking about here on the animal health side, some of the things that we've got in our National Action Plan are really focusing on optimizing prescribing practices and improving infection prevention and control. And that really brings it back to the things that we can do to help to tackle this issue. Next slide, please. Thank you. So these next couple of slides are drawn from our VARS report, which the VMD publishes. It's the Veterinary Antibiotic Resistance and Sales Surveillance Report. So do go and check it out if you haven't looked at it and you're interested. So this shows the national UK level sales figures for antibiotics for veterinary antibiotics in recent years. They're not pure sales figures, they are corrected for the populations of animal species in the UK, so they can be compared year on year. And that's represented as milligrams per kilogram. It's not literally milligrams per kilogram in a dosing sense, it's milligrams per kilogram in milligrams of active substance, correcting for kilograms of animals at the time that they would be treated. So you can see that back in 2014, that was 62.3, and there was a really dramatic drop that accompanied all of the activities around and the publicity around that period of time when the O'Neill review was published with its recommendations for setting targets and that kind of thing. And I'm not going to step on Chris's toes. I think he's going to talk about some of the work on in the agriculture sector, which is probably going to touch on those targets. But so we come to that point. We've had a 50% drop over a number of years, which is a phenomenal success. And that's the kind of success that the government cannot do. That has to be achieved by people prescribing better, people prescribing less, by the need to prescribe being prevented by preventing the diseases in the first place. But it's a phenomenal achievement. Thank you. Yeah. So, and this slide, again, it's really impressive. This over the same time period shows the reduction in the use of specific antibiotics, which we class as highest priority, critically important antibiotics, and that priority and critically important nature is reflecting their use in human health. And you can see the downward trend. You can see that we're dealing with fluoroquinolones, third and fourth generation cephalosporins, and colistin. But the particular thing I want to draw your attention to here is the y-axis. So we were talking about 30 milligrams per kilogram in the previous slide. Here we're talking about that the highest is 0.35 milligrams per kilogram. So really, tiny amounts compared with the overall sales, and yet still reducing. So so that's a really good picture. Next slide, please. This is one which is really it's a really interesting slide, but it's also one that I always urge caution when you're looking at it. So this shows you, it's a bit outdated. We're doing another One Health report looking at human and animal antibiotic use and resistance, which will hopefully be coming out in the next within the next year. But this is from the last one that we published in 2019, and you can see, you may recognise that 62 milligrams per kilogram on the left-hand purple bar. Then the 37 represents the 2017. So those are from the same graph that you saw 2 slides ago. And on the right are the same units for people, and you can see that the use in people is significantly higher, and also that it's reduced a bit less. Now, I always caution with this that with animals, we're looking with most of the antibiotics are used in food producing animals, and food producing animals by and large are young, healthy animals, and so we absolutely wouldn't be looking for the two to be similar. It's completely appropriate that the use in animals in this context is less than it is in humans, and significantly so. We are obviously seeing a decreasing trend in both, but I think the other thing that it highlights is that actually there are some areas where, I mean, I don't envy our medical colleagues some of the ethics of the decisions that they make in people. It's hard enough in animals making that judgment call. I can't imagine what that's like as a human medic. So but I think it's useful to have this comparison. It's useful to take that One Health approach and understand what the pressures are, and actually what we can achieve in the animal sector, and maybe where that can have a valid benefit effect on the human side of things. And the last thing on this slide that I'll say, just for context, is we've just been talking about the UK at the moment, but if you look at our neighbours in Europe, then we've not only decreased our antibiotic use in animals compared with ourselves, but we've also decreased it, and we're lower than average in Europe. In Europe, the median mg per kg figure is 51.9, and the range is 2.3 to 393. So you can see that we're doing pretty well compared with our peers as well, particularly given the size and of the agriculture sector that we've got here in the UK. Next slide, please. So yeah, I've said a lot about how impressive the results are, and they really are. And I think that it's not just that we've collectively, I say we, that you collectively have achieved this, but it's also the fact that some countries have done this through legislating. They've done this very top down, and that's not been the case here. It's been very much a team effort. It's been from the ground level up, figuring out what works and then implementing it. You can see the points here, and I'm not going to read them out. You can read them for yourselves. But I think that the other thing here is that you'll see that that Chris will pick up on some of these elements. One thing to mention is that we, because this is such a great story of recognizing the problem and then doing something about it. This is something we've actually pulled together into a case study report, which will be published later, and maybe that's something that can be, we can circulate to show you that story. But yeah, there's always room for improvement. There's always room for refinement, and also not resting on laurels, I suppose. So I think that that's something that the SMART goals that we're here to talk about can really help in actually focusing on making change where it's needed. Next slide, please. And so for those goals, next two slides I'm not going to spend too long on. They're really just to say this is a nice summary of a very high level overview of what's inside the UK's five-year National Action Plan. Just to say, this is you can see all of the areas, the content areas, and on the left, and the levers on the right. And if you have a look within the report, you'll see little grey boxes, and these grey boxes have our goals, so government's goals, I guess, that do extend beyond government. But those are the things that we've identified as things that we want to do. You will also probably notice, if you look at them, they're not very smart, and they could be better, and we certainly work on that internally. But don't take that as your template, but maybe take it as, if you want to see, maybe as inspiration, perhaps. So that was what I wanted to highlight on this slide. And then if we go to the next slide, this is from the 20-year vision. So this is a much longer term kind of higher level thing. And I think that the ambitions here, these longer term ambitions, again, for me, that they're also kind of inspiration as to the different types of areas where maybe goals could be drawn from, and I think that here we've got 3, minimise infection, 4, safe and effective care to patients, 5, protect animal health and welfare, 8, appropriate use of antimicrobials, and 9, engaging the public and other people on AMR. Those are really clear things which are relevant here. Next slide. So, and this also is from the 20-year vision, and this again, it's one of my favorite bits from it. Sounds geeky, doesn't it? But this is, I talk about them as government strategies. They're published by government, but government isn't going to fix AMR. Government can do what government can do, but actually there are so many areas and so many people that need to act if we collectively are going to make a difference here. And we had some really interesting conversations with some whole broad range of stakeholders across different disciplines: human, animal, food, academia, and more. And we really identified that actually this section of from the people who are prescribing, the people who are administering, the people who are all those sorts of the stakeholders, that's actually where most of the action is needed. And one of the things in here that we reflected on is that these are also the people who are not paid to do AMR. So, but you collectively are very, very much fundamental, a fundamental part of this community of people who are involved in whether or not we succeed or fail on tackling this issue. Thank you. Next slide. So just got a couple of, this is my penultimate one, I think. And I think because we're a bit tight on time, I'm not going to dwell on this one again. This is, I'm sure you'll hear more from Fiona on this, but absolutely, I think the strength here is fostering that collaboration, bringing the whole team together, the whole practice team together, individuals together, maybe different practices. I think it's got a huge amount of potential to make the kinds of connections that are not possible in other fora that we have access to, and maybe even across to collaborate locally with medics, perhaps, understanding the importance of certain antibiotics in medical practice is certainly something which is really helpful in understanding which antibiotics to prioritize the care of, and actually why we're doing it. For me, that's a really strong driver in understanding the benefits that we're generating beyond our immediate patients. Next slide, please. And this, I haven't got very much to say about this, except to say that if the VMD was a vet in practice, then this is maybe what we would be thinking of doing. So this is shamelessly tailored towards the kinds of things that we're really keen on achieving. But maybe, if nothing else, this is food for thought. And if any of you decide to do anything similar to this, then we'll be very chuffed. Thank you very much. This is my last slide. Thank you for your attention. Very happy to answer questions when we get to the discussion. Thank you.
Thanks, Kitty. It's great to see the kind of the background there, but also all the improvements that have already happened. You know, the profession has come a huge way from when the priorities really began around AMR, and it's good to not forget that, but also, you know, the support to push onwards and upwards. I'm going to now hand over to Chris Lloyd. I'm lucky to be able to introduce him. Chris is Secretary General for the Responsible Use of Medicines in Animal Alliance, RUMA, and he's been immersed in the livestock sector throughout his career and has practical experience from being a farmer in his own right. Prior to joining RUMA in 2017, Chris spent 30 years working in the sheep and beef livestock sector and the National Sheep Association and AHDV Beef and Lamb. And Chris will present an industry perspective on antimicrobial stewardship in livestock. So over to you, Chris.
Good afternoon, everyone, and thanks for the opportunity to contribute. I'm passionate about Farm Vet Champions. When it was talked about, probably in its early instance 2 years ago, I could see that we already knew that the role that vets play in the responsible use of medicines is really key, but obviously it's about their relationship with farmers, and I think the Farm Vet Champions tool and the SMART tools really help in that engagement. So as Chris mentioned, I work for RUMA. That's an alliance of 26 membership organisations that represent the entire farm to fork element of the industry. And our focus is on the responsible use of all medicines. But for the past 5 or 6 years, we've had a particular focus on antibiotics following the Lord O'Neill report, which Kitty introduced and mentioned earlier on. That really made AMR a priority for the UK government, and it's a One Health approach, but agriculture has to play its part. So I think the words Kitty used were, why do we care? My words would be, what are the motivations for us on the livestock side to reduce our antibiotics? And I can think very easily of 3. We could probably discuss more, but one is to reduce the risk of AMR and any potential threat that could impact on human health. And that there's science there that suggests that there is a link, but it's tenuous. But there's a real public perception, a real public image risk if we are not seen to be contributing to that One Health approach and dealing with the AMR challenge. Second one is obvious, to protect the use of antibiotics for the use in animals going forward. And we've seen in the use of anthelmintics, particularly in the ruminant industry sectors, where we've used these products, worms have developed a resistance to it, and it creates problems for us further down the line in terms of our choice of medicine. So protecting the use of antibiotics for our future use in animals is really key. And through voluntary action, we hope to avoid regulation. I think that goes without saying. And a lot, the work, just to reinforce a point that Kitty made, the work that's been done so far has predominantly been through voluntary action by the industry. So if you look on the RUMA website, you'll see guidelines for antibiotic use, well, guidelines for various things, but predominantly antibiotic use, and they go back to prior to the O'Neill report. So it's been an issue that RUMA's been looking at for years, but those guidelines have been updated and added to, and I think it's important to understand that those guidelines are now kind of embedded into most things that we engage with. Farm assurance rules, supply chain rules. The industry has really got its head around the responsible use of antibiotics. Responding to the O'Neill report, RUMA set up the Target Task Force in 2017, and with a vet and a farmer representative from every sector, we set about setting targets for each of the sectors in terms of antibiotic reduction, but also understanding the position that their sector was in. And not all sectors are in the same place. I'll come back to that later. But I emphasize the fact that we had a vet and a farmer from each of the sectors, which really helped us understand the whole picture in terms of engaging farmers and encouraging responsible use in each of those sectors. Those targets were reviewed in 2020, and they now align with that UK AMR strategy, which Kitty showed us the slide of. So our targets now run up to 2024. And I think what the Target Task Force has done, one of the things that it's done is it's created a forum in each of the sectors, and the Target Task Force representatives are now sort of supported in each of the sectors by stakeholder groups. So in the sheep sector, it's called the Sheep Antibiotic Guardian Group, involves NSA, involves Sheep Vet Society, involves AHDB, the National Farmers Union, etc., etc. And likewise in the cattle industry, in the pig industry, in the salmon sector, we have now established stakeholder groups which are aware of the issue and doing what they can to address the responsible use issue. And overall, it's a good news story. Kitty showed us the figures, 52% reduction over the last 7 years, which means we now use about a quarter of the antibiotics in animals that are used in the UK. That's down from nearly 40%, I think, on one of the slides that Kitty showed. So we've got a positive story to tell, but the work is not finished yet. As I say, over that time that the industry's raised its awareness, and we've seen a number of initiatives established to support the industry and contribute to the industry's effort in that their use of antibiotics. So I think about things like the e-medicine book, which is a tool for the pig sector to collect their data. Well, I'm going to go on and talk about the e-medicine hub. It's responsible use rules are now intrinsic in all the farm assurance schemes. And we've got the Farm Vet Champions initiative, which was started in 2021. Now, I mentioned that not all the sectors are in the same boat. So the poultry sector has been on this game for 10 years, and they've reduced their use of antibiotics by basically 3/4, 75%. And their use of HVCAAs is now down to, they've reduced that by 95%. So I think that's a really important message for us as an industry to communicate to those that look in on us and wonder, are we acting responsibly? We now use less than 1%. Less than 1% of the antibiotics used are those highest priority critically important antibiotics, which should be reserved for human use. Not all the sectors are on the same page, as I mentioned. And when I think back to my kind of background, the ruminant sector, we're definitely playing catch up in terms of understanding the data. We now have the Medicine Hub, which is coordinated by AHDB. But for the ruminant sectors, the challenge is about getting the data into that, understanding what we use. We have a good story, but we need the data to underpin it. And that will be all the more important as we go out into this new post-Brexit world and negotiate trade agreements for exports, and also consider the impact of some of the imports and equivalents on products that are coming in. If we've got data to underpin our animal health credentials and our use of antibiotic credentials, we've got a strong story to tell. And we know that data is really important in terms of driving the industry and engaging the industry. And we've seen that in the pig sector. So, but the data is important at two levels. For me, it's important at a national level to tell that story. And as I mentioned, in terms of potential sort of input into arguments on imports and exports, but it's really important at a farm level. And for those vets on the call, that's where it engages you, I think, because it provides another tool to talk to farmers about their enterprise, to analyse what's going on with their enterprise and engage with farmers. So data is really important. The ruminant sector is catching up. We now have the tool in terms of the Medicine Hub. And I mentioned red tractor rules, that's guiding us towards that. In the pig sector, it was a game changer when inputting your data to the e-medicine book became a requirement. We will get there with ruminants, I'm sure. It wasn't possible to put that into the last round of changes last year, but moving forward over the next few years, I think you'll see a requirement for farm assured producers to input their data. They're already doing that in Wales in the Welsh scheme. Finally, I think what's pleasing for me, I think, is that in this discussion and in the journey that we've gone on over the last few years, things aren't happening in isolation. They're all joining up. So we've got the launch of the government's Pathway Programme, which is one of the new initiatives to put funding into agriculture. There'll be a lot of animal health elements to that involve a lot of vet time potentially in terms of doing annual health reviews with farmers, collecting their data. And through rumour, we've got a requirement to collect the data and input that data into the Medicine Hub. So that will help that data collection process, but it isn't just a worthless chore. That provides data for the vet to then engage with their farmers. That point I was making earlier on about engaging with producers and using that information to sit and talk to them. So I think that that the Pathway Programme is another game changer for me. I think it's for years we've talked about trying to get money from government into improving animal health on farm and perhaps supporting testing, looking for underlying diseases. That is a demand on the veterinary profession. I accept that, but I think it's a game changer in the way that vets and farmers have their relationship. Instead of being fire brigade people that come out and inject my animals when I've got a problem, I see vets being much more as a consultant and improving the animal health on the farm overall. And that's a role change that perhaps vets are beginning to get their heads around. And then finally, I come to the Farm Vet Champions and the SMART goals and all of those tools which I've talked about, the Medicine Hub, the data, the Pathway Programme and so on. The SMART goals tool within the Farm Vet Champions provides you with the ideal tool, if you like, to engage in those things by sitting down with a farmer, setting you can have practice goals, you could have individual client goals, or you could have group practice goals with your clients. The Farm Vet Champions platform not only provides CPD to help vets and vets in training to have the right information, but it provides an ideal tool to manage and collate and guide and steer and encourage some of those actions that I hope will become commonplace in years to come in terms of engaging with farmers. So I'm really pleased to be part of the steering group for Farm Vet Champions. I'm really pleased to be here this afternoon to see it as it's rolled out. And I think it's a real positive addition to that sort of joined up approach that the industry has to the AMR challenge. Thank you.
Thanks, Chris. It's great to hear the kind of cross-industry cooperation on this from across all the sectors and the work that's going on. So, thank you very much for that update. Next, I'm going to introduce our fantastic Farm Vet Champion clinical lead, Fiona Lovett. Fiona runs a sheep veterinary consultancy business, Flock Health Limited, which works with vets, sheep farmers, processors, retailers and pharmaceutical companies in the UK and abroad. She is a past president of the Sheep Veterinary Society, chair of the Sheep Antibiotic Guardian Group and a member of the Rumour Targets Task Force, and a clinical associate professor at the University of Nottingham. So Fiona is going to introduce the new phase of the Farm Vet Champions collaborative project, the SMART goals. Fiona, over to you.
Thank you, Chris. And thank you, Chris and Kitty as well for what brilliant lead in. So for those of you on the call who have not yet don't yet know about Farm Vet Champions, we launched phase 1 a whole year ago. And as people have already said, it's free to use CPD modules with very applicable take-home messages. We've had over 680 people sign up the platform. There's plenty of you who have accessed those CPD modules. If you haven't, then this is just a taster. These are some of the logos of the people we're working with, people who've contributed that content, and people on our steering group. So this is a hugely collaborative from the veterinary and agricultural associations around the country. And just as a taster, this is what it looks like, the CPD on offer. Any UK vet professional working in practice or associated with the food supply chain, if you've got a commitment to set goals and develop good antimicrobial stewardship practices, then you're welcome to call yourself a Farm Vet Champion and sign on and start using the CPD. But we've also got free access to the platform for all students, vet professionals, vet students, and any practice support staff. So anyone in the practice team can access the platform, which makes it something that's sort of available for everyone. And I've always been a bit excited about the CPD, but really excited about the SMART goals. So from my point of view, it's the SMART goals that moves it beyond here's some CPD that you can access to actually how can I apply this in my practice situation, or where I find myself in the workplace, what can I do with my clients, with my colleagues to actually make a tangible difference. So what is a SMART goal? A SMART goal, I kind of expect you know all this by now, it's something that's very specific and measurable. It's got to be achievable and realistic to where you're at, to how your practice is. And we're putting a time, and it's time bound. So we're being very specific about it, how it's something that we can actually measure. So the platform, you go into the normal Farm Vet Champions, and we sort of have it, we can walk you through the system. And so from the SMART start, you can decide, do I want an individual SMART goal or do I want a team SMART goal? And then it's kind of simple to use, it's engaging, it's interactive, but the individual SMART goals, so that's anybody in the practice, you might actually be on maternity leave or between jobs, you can still sign up as a Farm Vet Champion, you can still set your individual SMART goals. But when you're in a team, and that could be a practice team, it could be somebody elsewhere in supply chain, their team of vets, it could be made up of a single practice, your team could be a branch practice, it could be a group within a group. So in my world, it would be all the sheep keen vets within that corporate group. Maybe it's an industry group, maybe it's a committee of one of the societies. I'm keen that from a sheep vet society point of view, we can set up a team within the society. There's no limit to how many different teams you can be on. This just, as you sign up as a team and invite other people, you can then work with that group in it's like Venn diagrams. You can have overlapping, you're not just in one team, you can be in whichever teams you want to be as you set your SMART goal. And then it works you through so that the what category is specifically based on the areas that the Rumour Targets Task Force identified as key areas that ruminant vets need to be working on. So the people category is all about engagement, engaging with clients, engaging with other members of the practice. So it may be a people goal, it may be a data goal, i.e. are you collecting, interpreting or collating data? Are you uploading data to the Medicine Hub, for example? And then it can be an animal goal, so anything at the farm level, and it can come into any one of those categories. It's sort of to help focus you a bit. If you don't want to categorize your goal, you can skip this option, but it's just to help us work out where people are setting goals. And then it walks yourself through to who's involved, and then this is a how section, so it can give you, you might not be feeling desperately inspired, and you can look through what are other SMART goals, what have people on the steering group suggested are suitable SMART goals. Kitty had her wish list up there. You know, there are other practices, other teams who are setting goals, so you might want to be inspired by their goal. But then the platform will allow you to modify that to make it bespoke and personal to your own situation. And then the platform will come back and summarize your goal back to you. So for example, this goal that I might have set, it's an individual goal. It's I tick the data collection, Medicine Hub options, and my people options were, it was for vets and farmers, and in fact the whole practice team. And I commit, and I've put in this goal, I'm commit to talking to 20% of my farmers about how to upload data to the Medicine Hub. And then the details is just a personal thing to me. I put in notes to help myself as I come back to it, to guide myself on that goal. So this particular thing was for dairy, sheep and beef clients. It can be whatever suits your practice situation. So and you end up, there's a dashboard there for each Farm Vet Champion user. Brings all your goals together. You have your individual goals and you have your team goals. And as you can see, a goal can be as simple or as complicated as you like. To be honest, I'd advocate some quite simple, achievable goals in the first instance, something you can track quite quickly. Maybe it's literally just watching a few modules of the CPD and tracking that CPD. Maybe it's you're talking about this is highly topical. That's just literally at lunchtime today that I saw NOAA had launched telling people about the livestock vaccine guidelines that they're launching next week. You know, it may be that you're committed to working through that sort of a document with your clients, and you might say, I want to talk to 20 clients. You might say, I want to talk to 75% of your clients. You know, it doesn't matter. That's up to you and up to your team how ambitious you want to be about it. Although I have to say, in the first instance, I think I'm setting some quite simple goals to start off with, because I like to be able to achieve them. And then it will allow you to track progress. So you can go back into the goals. So this one, for example, is committing to working with our client accounts to make sure that we've actually allocated them by enterprise. So we know something we've dealt with a lot in the sheep and beef industries is how a lot of people have mixed farms. Actually, from a practice point of view, if you can allocate those into different enterprises, it makes a huge difference. But as you make progress, as you talk to clients, you can actually move this progress bar, and that's up to you to say how you're progressing through it. And again, you can put your own personal notes in there to remind yourself how you're doing. So that's what I'm going to say. The capability of this platform is absolutely fantastic. We've had some brilliant people at RCVS Knowledge working on this. It's really flexible, it's really inclusive. So the limits are really the imagination of the users. We totally envisage that it could be practice teams, it could be corporate groups, but whoever it is using it as a hub to keep each of us motivated and accountable with each other. So I suppose my role here is just to encourage you to go to the site, to sign up, to have a look at the CPD, and just try making some goals, inviting other team members, and see how you get on. That's me really, Chris.
Thank you, Fiona. Thanks for that that great summary of the work that's gone on there, and how people can get involved. I think you know, I'd echo for everyone to have a look, and just the easiest way is just to get started, really, and then hopefully it'll snowball from there and support you. So I'd like to now invite you for some more questions. We've had a couple of questions through on the chat already. And I think Chris might have answered a couple, but if I just get them, if I read them out, and maybe if people haven't had a chance to read them, then we can discuss them here. So the first, there's a call from Gavin Morris here. The first one is around terminology, really. So Kitty, in one of your slides, your ambition 8 was a demonstration of appropriate use of antimicrobials. And the question is there a move to a phrase as antimicrobial, as appropriate use, rather than responsible use?
I'm really happy to come in on this, and thanks, Chris. I've just been reading your answer as well. It's really, I think we have slightly different takes on it, and I think and which are equally valid under the different circumstances and perspectives that we have. I mean, for me, they're all kind of talking about the same thing, whether it's appropriate or responsible. And I've actually even pulled up, we actually have even discussed these sorts of things in certain meetings. So I mean, I've got a list here that we've talked about. So appropriate, optimal, responsible, prudent, rational, judicious. These are all things, and for me, it's all about using antibiotics in the right way, so that you're basically using them as little as possible, but you are using them when you need to use them, which is actually paraphrasing what Chris has said there. And the choice of word for me, it kind of means the same thing, and the only reason that I would sometimes choose one word rather than the other is if it just if one was more appropriate for circumstances. But for what it's worth, my personal favorite is appropriate. No no slight intended, Chris, on the fact that Ruma uses responsible in its name, simply because for me, I mean, responsible is definitely my second favorite, but appropriate removes the personal judgment from it. It's really talking about the use of the antibiotic in the circumstances. Anyway, yeah, for me, essentially they're the same. There's no hidden agenda. Thanks.
Chris, can I just add to that? I think I wouldn't disagree with you, Kitty, and you can have your preference if you like. But for me, I think the important point is this is, I kind of veered off a little bit and talked about sustainable use of antibiotics. We are not talking about zero use of antibiotics. When you have animals that fall sick, you need to have antibiotics in your toolbox if it gets to that stage to provide correct animal welfare. So I think that's the important point I would just make on the back of that.
Can I add one tiny thing to that as well? And I would say that it also includes mitigating any risk to public health from use in animals. I'd incorporate that into sustainable, but completely agree that sustainable is an important, a really fundamental point here.
Excellent, thank you both for that. There's got a second question which has been answered on the chat, but maybe we can just go on to a bit more discussion here. So there's a question on the medicine hub. And Chris, you talked about the importance of data in the ruminant sector and the medicine hub, and it's taken a big effort and a while to try and get this data in. And so Ruma don't currently have a mg per gig PCU target for cattle and sheep. The question is, should we just make this a legal requirement to send in the data?
I would avoid regulation. A legal requirement suggests regulation. So just to go back, it's taken time. It's been frustrating, I think, for those of us that have been involved in it, but we are where we are. There is considerable resource going into the platform's now available. So there is a tool now for the industry to collect its data, and AHDB are working with existing data holders. So Gavin will be aware of this with his particular supply chain. Some processors have data, In the dairy sector, there's already pockets of data, big chunks of data available. From the national perspective, if we can port those all into one place, that will help us have that national picture to talk about the trend and to sort of put across the industry's credentials. There'll be lots of discussions about who can see the data and how accessible it is. Can vets see it with their farmers? Can supply chains see it with their farmers? Can retailers see it with their farmers? There'll be lots of questions about that. But I think I mentioned in the chat, I truly believe the industry is behind this, and Gavin knows this as well, and I know he's very supportive of the Medicine Hub. There is a lot of work to do in terms of the detail. It's a complicated picture, but we will get there. I was on a mastitis meeting earlier this morning, and I was really pleased to see how in the dairy sector, they're joining up the BCMS animal identification data with the milk records. Now that will have taken some time to do, but when you can do that, that's really powerful. And in this case, if we can join up BCMS data to make that easy for farmers and vets working on behalf of their farmers to have that population data, and the data that's inputted is the medicine data that can come from farm practice records, that will speed the process up. So it's complicated, but we are heading in the right direction. We're confident that this year we will have the number of data sets in the system that we were looking to have. That then triggers the opportunity for us to get a mg per kilogram figure, as Gavin was referring to. But it takes time then for us to have that mg per kilogram figure over a time period. We've got other data sets that give us an indication of what's going on in the dairy sector, and the general picture is a downward trend. But we do need it for beef and sheep. We need it to be able to promote the industry's positive story.
Yeah, it's a great way to demonstrate all the good work that's gone on. Is actually evidence it, and back to the kind of the work that we do in our core, which is evidence-based veterinary medicine. You have the data, you can then move on, improve, and use it all. So I think yeah, brilliant, thank you. Fiona, I've got a question here for you. Is there a mechanism for a group login for monitoring team progress against SMART goals? E.g., if I enter some practice goals under my account, how can everyone else access it, or is it my responsibility to keep them informed?
No, the way it works with a team is you've got a tab where you can manage your teams, and so you invite other people. So to be in a team, you have to have signed on to the site and watched the obligatory video. Is literally only 5 minutes, but you do have to have watched that. This is what a farm vet champion is about, to get into the site. Then so as you've set up your team, you've given an email address, that person will then be invited to sign on, and also all they have to do is watch that video, and then they can sign on and also access a team account. So Rachel, you're not responsible for everyone else, but you do have to let them know that you're inviting them to a team, or I mean they'll get an email, but if you've had that conversation and pull people in, that's but they then log on to the site separately to see it. So I would say, as long as people are having the conversation out with the computer as well as it coming through emails and stuff, that's probably a better way for it to work. But it can all work through emails if you want to do it that way. Oh, and the site also has, you can set preferences how you want to be reminded. So if you have set goals, you can say, do you want the platform to remind you about it on a weekly basis or a monthly basis, or never? If so, and then you'll just be sent an email to say that thanks for setting a SMART goal. Just a reminder that this is where you said you're at, just as a kind of just an aid memoir really, but you are in control of how often that reminds you.
Thank you, Fiona. Thanks for that. We haven't got any other questions come through, so I think it's an apt point to close the meeting and let everybody get back to what they were doing beforehand. I'd just like to thank everyone for attending, but also the team for their hard work in putting this SMART goals work together, the VMD support, and everybody that's been involved in the steering group, and also the wider stakeholder groups. It's something that we really acknowledge and really proud of is that actually we've been able to work across the industry with so many different organisations, bodies and people, and they really pulled together to help deliver something which I hope will be incredibly useful for everybody there. So unless there's anything else, I'd like to draw this to a close and say goodbye and thank you to everyone. Thanks a lot.
Thank you, Chris. Thank you, Kitty and Chris.
Thanks. Bye.
Thanks very much, all.
Thank you.
Thank you very much.
Thank you, everybody.